But first, a little later in the show, we'll take a closer look at the Prime Minister's reset speech today to the National Press Club. Well, let's focus where he focused on the pandemic and how we've handled it or not here in Australia. Remember from the outset, the whole point of our national policy response to the pandemic was to flatten the curve so that the hospital system wouldn't be overwhelmed, that if people got sick, really sick, we'd have enough ICU beds and ventilators. Even now, the ongoing rules about wearing masks and working from home and isolating if you're exposed, social distancing too in venues, are there lest COVID patients flood our hospitals. Well, that's what we're being told, isn't it? But what doesn't seem to have happened, and you'd think this should have been government's first priority in response to the pandemic, was a rapid ramp up of our hospital capacity. Instead of boosting hospitals to cope with the surging cases, in some states at least, we've suppressed normal activity to avoid having to ramp up hospitals, or because the hospitals were already crook long before COVID. At the start of the pandemic, you'll remember Victorian Premier Daniel Andrews announced that he'd spend $1.4 billion to create an additional 4,000 ICU beds so that hospitals could cope.
Notion that we're going to have 4,000 beds down at, a warehouse somewhere, turn the exhibition buildings into an ICU unit and then have a nurse at the foot of each of those beds practising hospital corners. No, that's not how it works. I don't rule out Melbourne Convention Centre. I don't rule out the exhibition buildings, whatever it might be, a really big space.
And whatever might have happened to those millions, what we know is there's still hardly any extra ICU beds in Victoria. The truth here is damning and made all the worse today by a major report from the Productivity Commission highlighting the sustained problems in the Victorian hospital system and the way Victorian ministers have used the pandemic as an excuse or cover for their own failures. Yes, hospital spending is up thanks to the pandemic, but hospital performances, well, they're not. Hospital spending in Victoria on a per capita basis is the lowest in Australia. There are fewer beds per capita in Victoria than in most other states, and hospital staffing per capita is lower in Victoria than in all other states bar one. This helps to explain why the performance of Victorian hospitals is getting worse, not better. 79% of serious emergency cases were seen on time in New South Wales hospitals last year compared to just 62% in Victoria, and 36% of Victorians on elective surgery lists, well, they'd faced extensive waits last year compared to just 12% 2 years earlier. And actually, the Victorian government is in full-scale denial, with the Health Minister claiming that not a day has been wasted. It is now obvious that in several states, in WA and Queensland, as well as in Victoria, systems were already under so much strain that they could never have coped with more. And the truth is, to paper over these cracks, we've been kept locked up in our homes because hospitals were never ramped up as they should have been. But it didn't stop there for the Victorian government today after revelations that the Chief Health Officer, Brett Sutton, had not been consulted on booster mandates, even though the Premier has already signalled he's looking to force people out of their jobs if they don't comply with all 3 jabs.
I haven't been requested to provide advice on broader vaccine mandates.
I've had that discussion on multiple occasions with the Chief Health Officer, his deputies and the entire public health team. I don't understand what the process is. People who choose to be blindly and deliberately ignorant of this do the Victorian people no justice. The system is what constitutes being fully vaccinated is a matter for the Australian Technical Advisory Group.
So much for the mantra that we've got to take the health advice, isn't it? All right to tell us that we've got to take it, but it's hardly fair when the government's now refusing to ask for it in the first place. And while I'm at it, am I the only one sick of being forced to check in everywhere I go in Victoria when the Victorian government's been forced to admit it's abandoned contact tracing months ago? So why check in if it makes no difference anymore? It's all very well, isn't it, to focus on the upcoming federal election, as we should. But let's not forget there's a Victorian election this year as well, and a South Australian one. And as we've learned from this pandemic, the federal government is not the only one that matters.